Hello, everybody. Good morning, good afternoon, wherever you are in the world. And thank you for joining today's webinar on the DHIS2 Climate Data App. I'd just like to let everybody know that we are recording this webinar. It's also being live streamed. I welcome everybody that is joining to be able to introduce yourselves in the chat, and also you can use the chat to ask questions throughout the presentation. We will have a session or time at the end for questions and answers, and we'll also use our community of practice to address any questions that were not answered during this webinar, and please feel free to contribute to the community of practice as well. My name is El Gallerano. I'm the project manager for the DHIS2 Climate and Health Project. And I'm joined today by my colleagues, Patrick O'Neill, the Climate and Health Regional Implementer based in DHIS2 Uganda, and Andrew Muhire from Ministry of Health Rwanda, that will be speaking today on the Climate Data App, as well as the Rwanda experience of installing the app on the national HMIS. Next slide, please, Patrick. And I'd just like to say that this climate app is made possible by an investment from the Wellcome Trust into the HISP Center in order to build on existing DHIS2 systems for the help of developing climate and health analytical and modeling tools and data visualizations and dashboards. It's a very exciting initiative that we are diving into. Next slide, please. And as we've said before, in the past, DHIS2 is very widely used. 70 ministries use DHIS2 as a national information system, as well as another 10 countries using it at a subnational level. So we're looking at how countries are already routinely monitoring health outcomes that are influenced by climate change, as well as information that can measure impact on facilities and health systems. And we're looking today at how climate and health integration can help provide a holistic view of how climate factors contribute to health risks and enabling a deeper understanding of the relationship between environmental conditions and health outcomes. Next slide, please. And I'd just like to touch on some of the benefits of using climate data in DHIS2 to help health programs. Can be looked at planning interventions and resource allocation, analyzing and using climate data with routine disease surveillance data for near real-time monitoring as part of an integrated HMIS, as well as responding to localized climate-informed early warnings with targeted interventions to maximize effectiveness and cost, integrating and making integration and visualizations between epi data, entomological data, vector control data, and routine data coming from a variety of programs, as well as tailoring data visualizations for subnational use and automating the distribution of surveillance bulletins. So with that, I would like to hand this over to my colleague, Patrick, for next slide, to talk about our climate data app. Thank you.
So thank you so much, El, and welcome everyone. El already introduced me. I'm Patrick O'Neill. I'm based at DHIS2 Uganda, but supporting the regional implementation of this DHIS2 for climate health. So, the whole gist of this webinar is really to focus on this application that is really centered around integrating climate data into DHIS2. And so, so the overall picture is, if we are to leverage on DHIS2 platform for climate-informed health programs, then there are probably two things that we need to focus on. And part of this webinar is to focus on one of the products that has been developed. So we are looking at the first one, of course, is data integration, where we have to make sure that we're able to integrate data within DHIS2. And then the other one would be data analysis. And with analysis, we know DHIS2 has done a lot with terms of building the analytics. But for this climate and health work, there's the component of modeling that also needs to come in. So, so the focus will be on these two products, But for now, the focus is on the first one that allows for us to integrate data within the DHIS2 platform. So as you can see this illustration, DHIS2, within the DHIS2 core platform, we have health data. And so the application that we are introducing today is just to try and integrate this climate data into this core platform so that you can go ahead and do the analysis. And then the second part will be now, how do we do modeling and prediction? And for that, we are looking at extending the DHIS2 to be able to support that function. But that may not be possible within the core, but it could be within the server extension of DHIS2. And the way that would work then would be if you get climate data into the core DHIS2 and you have that already with health data, then you could then pull that into the modeling tool, be able to do the modeling and prediction, and then be able to push that back to DHIS2. So this part 2 will be coming later, but for now, the focus is this part where we've been able to integrate climate data and specifically global data into the DHIS2 platform. So what does this application do? So two main things that this application does. It helps to explore data, climate data, and then the second one it does is to import this climate data. And I'll be demonstrating that shortly. And specifically, we are starting with 3 variables. The first one is temperature, precipitation, and humidity. But as need arises, this will be reviewed from time to time, and that list may be built upon. But for these 3, we've been able to demonstrate that yes, it's possible you can do the integration. Then also the new component that has been added is the weather forecast, the 10-day weather forecast that can also be you can also be able to have a 10-day weather forecast, but this should be when you're looking at a health facility or a point location, and we shall be demonstrating this so that you can appreciate how this works. But in the process of integrating this data, as you'll learn later, that the data we are dealing with is gridded data, and if you understand the structure of DHIS2, most of our organizational structures are based on, of course, polygons and also point locations. So there has to be a process of getting this data that's gridded to be able to get a value that you can have for, say, a district or a health facility. So there's that process of computing values that befits our DHIS2 kind of structure. So the data we are importing is daily, but of course, as you analyze this data, you can come up with weekly, monthly, or even quarterly, or you could also have an annual kind of aggregation. But the beauty is that once you've imported this data into DHIS2, you can then go and use the core DHIS2 features to do the analysis. And here you can use the data visualizer, you can use the maps and all the other features that allows you to analyze data within DHIS2. And there you can do triangulation or any other analysis that you can quickly do within the core features of DHIS2. And maybe just to mention again that the data set that we are integrating is called ERA5, and I will show you that shortly. This ERA5 land data is the most accurate and complete global climate data set that's available. And being a global data set doesn't mean that we are not interested in local data. There's a great need for local data, and for reasons that, creates ownership of this work, but also it helps to validate what we are getting from the global. So it's very important that we consider bringing in local data. So again, this app, we are still taking it as pilot because there's a lot of updates that are ongoing to make it better. But it works, it's able to integrate your climate data. But there's a lot of feedback that we still need to get. So there will be a lot of updates, and we would want that you frequently go look into our app hub to be able to get the latest updated version. And again, to say that this is not part of the core core feature of DHIS2. It's an application, but as need arises, some of the features may be considered to be integrated into the core DHIS2. Yeah, so this is really how we are able to source this data. So the data source that we are getting is from this source called ERA5. And this source comes from the European Center for Mid-Range Weather Forecast that goes through a process called reanalysis version 5. We will take you through that quickly. But basically, the way they source this data is that when weather stations that come from national meteorology report this data to the World Meteorological Organization, this data is then accessed by the ECMW, and then it goes through a reanalysis process. Now, once it gets, so that reanalysis process basically combines this data that comes from weather stations with satellite data. And then it's made available through the Google Earth Engine, and then also the Norwegian Meteorological Institute that provides a web API. So for these two sources, with these two endpoints, then this application that sits within the DHIS2 is able to draw data through the Google Earth Engine, and then also through this API. So those are the sources, those are the points where we're able to get this data. So one does past weather data, and then this one does the weather forecast. So, so this is just a bit of a video that explains the process of reanalysis so that you understand. I'll play it shortly, but just to indicate that this is a global source, and the resolution is a 9x9 grid, and we will again explain that shortly. And you have variables, you have data from 1950 to date, and this comes hourly, but we've been able to aggregate on a daily basis. We're able to get for an average for a day. And you have up to 50 variables that you can actually generate. But from the reanalysis, this is the kind of data that you end up getting. It's gridded, meaning that you have this grid of 9x9 kilometer. So meaning for a given area of 9x9 kilometer, you can get a value for temperature, for precipitation or humidity. Now we have to go through a process of, because our districts, as you can see, are usually, they're not in a square, they're polygons. And so we have to get an average for a given district to be able to generate a value that we can store within DHIS2. And for a health facility where you have a point, so if that point falls within a given grid, that is the value that we take. So that's really how this data is calculated and made available within the DHIS2. So for you to be able to set this up within the DHIS2 is quite simple, I would say. The first thing is making sure you have the right version. And the version we are working with here is version 2.37 and above, should be able to work for you. Key to note is that your organization unit should be able to have should be geo-referenced, meaning that your district, your health facilities, whatever administrative level that you have in your DHIS2 that you'd want to explore the data or actually import the data for, you should be able to have the geo coordinates of those locations. And then also you should be able to have your DHIS2 instance connected to the Google Earth Engine, because that is what will help you do the connection to the Google Earth Engine. And then lastly, it is important that you have to set up a data set or a form that would help that would help when you're importing data into your DHIS2. And so you have to create the right data elements, the data sets, and then also the necessary metadata grouping. Yeah, so with that, then you should be able to explore the data and then be able to import data. So for exploring data, and I'm going to demonstrate this shortly, so I will be a bit quick with this. The first thing is you'll definitely need to select your organization unit at whatever level that you would want to look at. and then you start the process of exploring. So the first thing you'll be looking at is the temperature. So with the temperature, these are the kind of visualization that you'll be seeing. And again, I just want to mention that we are going to demonstrate this shortly. But just to quickly highlight that for temperature, we shall be looking at both monthly and daily temperature. And also we are able to look at what we call normal temperature, which one would sometimes call it expected temperature for a given month versus an average or a mean for a given period of time. And the difference will definitely help you to understand the change in temperature over time. We shall be demonstrating that shortly. And then the other parameter we are looking at is the precipitation. And again, precipitation, you should be able to look at it on monthly and daily, and also be able to look at the normal, which is the same as this, which is the same way we compute for the temperature, where you're looking at an average for 30 years and be able to compare, get an average value that would consider as your normal for a given month. And you should be able to also look at trends for a period of time. Again, we're looking at both monthly and daily. And then also relative humidity. We are also able to look at relative humidity, but this one we look at it alongside dew point temperature, air temperature, but also we're able to compare the normal and the relative humidity. Again, for the daily, we're able to just look at the averages for a given day. And then lastly, no, not lastly, there's one more, with this temperature change, or what one would say temperature anomaly. And here, again, we're able to look at the anomalies in temperature for a period of time, starting from way back in 1970 to the most current year. And here you can look at for a given month and see whether over time, for a given month, you've had some anomalies or changes in temperature that needs to be observed. And you can look at these two reference periods. We shall demonstrate also that one shortly. And then lastly, we have a new functionality that has been introduced. And this one helps with the 10-day weather forecast. You can look at weather forecast for a point location. And specifically here, we could look at for a health facility, and you're able to look at a 10-day weather forecast. This one, we are able to get it from the Met Web API that is provided by the Norwegian Meteorological Institute. So this one, you're able to have the 10-day weather forecast and to focus, of course, on the you need to be kind of familiar with these icons to be able to understand this, but I'm sure most of you are familiar with that. But alongside that, you should be able to have the maximum temperature, the mean and maximum temperature, the precipitation, the relative humidity, and the wind speed. But just to say that we are yet exploring how this can be useful to the users. So we are not importing it into the DHIS2 for now, but as and when need arises, we'll definitely see if this can also be imported, but we'll definitely need to hear from you, to get feedback from you. So then we also have a guide on how to be able to configure this, to be able to import data. As I explore the application, you'll be able to see this, but it's as simple as creating a few data elements, a data set, and then creating a group for that, and then be able to import. But while setting up the data elements, it's important to pay attention to the data aggregation, because what we don't want is data to be imported, say, at a health facility level, and be able to aggregate that for a district. That would be wrong, or that would not be accurate. So at each level, we have to import data and then be able to analyze it at that level. And then this is just a screen that shows the data import, but key to note is that we cannot import more than 50,000 values, and I'll be showing you that. You can only import data less than 50,000, but we are also in the process of making this much better based on, again, feedback, but also looking at how best we can make this work for your own experience. This is just a screenshot of how we are starting to look at the data. So here it was just some graphs and a map that was bringing together malaria and climate data. Again, I'll be showing you that shortly. So without taking a lot of time, let me switch to the demo so that you can appreciate, and then I'll come back to this later. So, for you to be able to, again, have this within your DHIS2, of course, you need to consider the things I mentioned earlier, the right versions, and making sure your DHIS2 is properly, has the right metadata that allows for the organization unit to be able to set that up. I mean, to be able to stream and also import the data. So here we have a demonstration instance that I'm going to use to demonstrate this. So this is a demonstration instance that's provided by Laos. So let me just log in. So when you log into the DHIS2 instance, and it's the first time this is going to be set up, you need to definitely install the application. So how do you install the application? You come to this apps menu and then be able to look at apps management. This is the tool that allows to install apps within DHIS2. So when I click on it, it should be able to take me to a place or connect me to the app hub. So this is where we have all the apps that are built for DHIS2. You can explore this, but the one that I'm interested in is climate data. This is the application, and this is the latest version. So to be able to install that, you simply click on that and then be able to install. Of course, there's information here, there are different versions. So always look out for the latest version to be able to install. So if I click install, it shouldn't take long. Of course, I'd already installed, but still just to demonstrate that. So already that is installed. So I'll come back to my apps menu and then be able to look for climate data. So this is the application. So when I click on that application, it is able to provide the different tabs that helps to manage, helps to bring out the features that we want. So the first one is the home tab that basically provides information about the data set that we are using. And you can see the video that I was playing shortly. So when you install this, you'll take time and play this video. And then also, it also talks about how the data is calculated. So it's very important for you to go through that. And then before I go into exploring the data, you have this provision to change the settings. This is very important to make sure that your time zone is right for you to be able to do the weather forecast. So this is very important to make sure that you set the right time zone. So we have all the different time zones here. You select the one that's appropriate. I've selected this because the demo instance that I'm using is based on that time zone. We also have the guide that talks about how you can configure the app, but specifically how you can set the metadata in your system to be able to import this data in the DHIS2. Yeah, and then I'll go to the one that helps to explore the data. And this is the most exciting one. So basically, when you're exploring data, at that point, you've not yet imported data. You're just looking at how climate data is looking like for a given location. And so what this application does, it pulls all your organization unit structure that is set up within your DHIS2. So for this demo instance, we have, this is at national level, and these are now the province. This is provincial level. So if I go down, these are the districts. And if I go down, I'm able to get the health facilities. So if I'm exploring this data, I could look at on any of these levels, as long as those levels have the organization, the geo coordinates configured, it should be able to help me explore the data. So let's start at a facility level. And the reason I'm starting at facility level is because I just want to quickly show you how you can start with the 10-day weather forecast, because we are not doing weather forecast at a district level. We are looking at it at a point location, which is typically a health facility in our scenario. So if I click on this health facility, you can see right away, I'm able to get the 10-day weather forecast. And again, try and familiarize yourself on how to interpret this so that you can make use of it. So this allows you to then look at the 10-day weather forecast. Today is Tuesday. You can look at that until next week on Thursday. The next, of course, you would want to look at temperature. Again, we are still within this same health facility. You can then start looking at the temperature for that health facility. And again, here we have monthly and daily. Yeah. So, so for the monthly, if we look at, let me try and expand this a bit to give a bit of, so if I want to look at, say, the trends from January of 2022 to date, and then update, then you should be able to have a period spanning for that, the different months spanning from January of 2022 to the current month of March. And here there are things I need to explain. I'll first turn off others, not to cause confusion. So I'll first turn off the range and then turn off the mean temperature. So I want to first explain this normal temperature. So this normal temperature is basically generated as an average for this reference period. So, and that is generated for each of the months. So, so if you look at the month of January, the normal temperature, or I would say expected temperature for a month of January, which is really an average for this reference period that we have, 1991 to 2022, is 22 degrees Celsius. So that is the January normal that is expected. Each time you look at January, you should be able to have that. Now, as data comes in, as of course time goes, you now need to compare that against the mean temperature. And here you are then able to see how does the mean temperature or an average for a given month measure with this reference period. And here you can clearly see that sometimes it's below, but for this health facility, you can see largely that most of them were above the normal temperature. And this gap is really the anomalies that we are always talking about. And that one we shall talk about it again at the end here. So this is how you're able to explore your temperature for a given period of time. And then when you bring in the range, this gives you the max and minimum for average for a given month. And so you can have that chart that has all those three in one. For the monthly, we're basically looking at just the mean and then the range for, again, for this period of time that we've been able to display. So that is how you explore a temperature. And it's very similar to precipitation. The only thing is just the graphs here a bit different. The other one was like a line graph, but here we've used this bar. But again, here we can look at precipitation for a month, and again also bring in this normal precipitation, which is based on a given reference period. And then also you can do the monthly. And again, here you can have this ability to kind of zoom in using this. And so you're able to kind of understand this in more detail. When you're done, you can just reset and be able to get back. And then not lastly, but we also have now, we have relative humidity. And relative humidity, you can also look at it, again, monthly, and then also daily. For monthly, there are a lot more variables that we're looking at. We are looking at relative humidity alongside, we'll turn off this for. So we could look at it alongside the normal relative humidity, which is again based on a reference period. But you could also add in the dew temperature, which I'm told is a key variable to be able to understand the relative humidity, and also the air temperature. So this is what you have for relative humidity. And then the last one is the temperature anomaly or temperature change over time. And again, here we're able to explore month by month. You can see if you look at, say, the month of March that we've just passed, you can look at an anomaly from 1970 up to 2024. as only the month of March to see how is the temperature changing over time based on this reference period of about 30 years. So you can see that that is high, but you could even go way back in period, in the period to start from 1961 to 1990. And then you'll see that the anomalies are even much higher, and you'll be seeing much of the red. And the red here means that it went above the normal that is expected. And that difference is what we're looking at here. And that's what is being measured by the change. For each of these, you can use this to actually view full screen. You can also download this if you need it for your presentation. So that is how you explore data. And this one was at a facility level. You could take it high up at a district level. And so for that, if I click on the district where that health facility belongs, I should also be able to explore data. But here, the only missing piece is the 10-day weather forecast that we're not able to do for now for districts or provincial level. We have put it only for health facilities. So here, the same things that we've been looking at. So this is how you explore your data. And once you've been able to explore your data, the next thing you'd want to do is to import this data, because what we are doing here is basically streaming this data through the Google Earth engine. It's not stored within your DHIS2. But the DHIS2 Climate Data App is just streaming this, getting that through the Google Earth engine and being able to display for you. But now for you to be able to analyze this data hand in hand with the health data, you definitely need to import it into your DHIS2. So when I click on this tab, import data, then it will give me a provision here. But there's instruction that you need to follow here to understand how this works. But the easiest thing is just to make sure that you're able to select the variables that are available for import. So if I select, say, temperature, I can then specify a period that I would want to import for. So here I could change to keep it short, maybe just starting January of this year to end to 31st of March, that period of about 3 months. And then I select a level here. Again, here you can select one of these provinces to import data for that province, or you can say province and then be able to select all districts under that province. For this demonstration, I can just pick one of these, one of the provinces here. And then I could choose a district level or health facility level, but to keep it short, I will leave it at a provincial level. And then here is where now you map this variable that you've specified here with the data element within your DHIS2. So meaning that you should have created this data element within your DHIS2. But when you're creating this data element, there's a provision for you to create codes. And once that code matches what is pre-configured, then it will automatically help you to select the right data element. So let's quickly import this. So here what's happening is it's importing data for 91 days. 91 days is from this period, start here and end there. And that's why you're having 90 days. Now this is being ignored because I think there's already some data. So let me switch to another. So let me try that. So if I run that. Yeah, so you see this one has no data. So it's been able to actually import data for this period of time. So if you want to import, say if I came here and clicked Laos and I say, give me data for all health facilities of Laos, you see you'll get this kind of warning because the data you're trying to import is a lot. And so you'll get this warning. So you may have to consider then importing maybe a province by province for this to be able to achieve importing for health facilities in the country. So that is how you import the data. And once you've been able to import this data, the next you'd want to do is, of course, then check whether the data has been imported, just to confirm. You could run analysis and then go use the data visualizer and analytic tools to be able to start running some pivot tables or any visualization. But if that is not something you can do immediately, you can just go into a data entry screen, and I'll just open one that I've already created. So how do you get there? You simply go into your data entry, use the data entry app. That's what we use to enter, because this is aggregate data, and then pick the province where we imported data. I think we did import for one of these. I could try. And then we did for a period within that. So, so you can see that temperature data has already been inserted into your DHIS2. And this is a simple data set that we've created. And when you're doing that, then you have your data within the DHIS2. So after confirming that you have data in the DHIS2, then you can go and start using some of the analytic features within the DHIS2 to analyze your data. So for learning, for demonstration, we've created some a small dashboard here, which is still actually just for demonstration. We hope we can get more input from the content experts to be able to improve the analysis. But what we've done here is, you can see we have created a graph, a line graph, which is a dual chart that is able to look at relative humidity and malaria cases. And this one, you're looking at a trend of January to, should have been December, so like a 2 years trend, just to try and see if we can see any pattern in the data. Yeah, so here we are just trying to run malaria and relative humidity, and you can see some similar pattern in these two variables. But again, we just want to caution that we are still seeing the best way this can be presented and analyzed. We have also been able to do a map here that can help you look at, again, relative humidity, and again, with malaria cases. And again, for this, you can have a choropleth map, and also with a bubble map to be able to show that. Yeah, so we also did a split map just to show the different months, and also how you can have the relative humidity for the different months varying. So you can see here, the relative humidity is much higher in October, and March, there's not much, I mean, it's much less in March. This is just, I think, to help people appreciate the temperature trends, say for a given country for the different district. So with that, I will then turn back to the last few slides before we end the. So the things to now think of is really the quality of data, because remember, we are looking at, for start, we're looking at global data, but with the time we are going to get local data. So now once you have these two data points, you have to do some validation. Yeah, but things to note out for is the more weather stations you have, the better, because even when we go through the process of reanalysis, some of the data comes from, and actually data comes from the weather stations, and then they combine that with satellite data to be able to go through that process of reanalysis. So for countries where they have dense weather stations, you would expect good quality data, or the data that's closely comparable with the global data. It's also important that you pay attention to areas that are mountainous or coastal areas, because again, when you're doing these observations, most of those areas may not be clearly observed, but also some of those areas may not have the stations available. And so some of those areas may be missed out. And so you need to find a way of how do you then get data for some of those areas that are missed. Maybe you need to think of a proxy of, if the nearest district that's close at that island, you could use that as a proxy to be able to use for analysis. And then also, the most important thing here is always look out for the trends in the data, more so when you're comparing the local and the global data. They may not be exactly the same, but overall, you will see a pattern that is similar. And then that will give you an indication that probably the data you're working with has some level of validity. And this is a good example of data that was compared for Laos. And here they were looking at the ERA 5 data versus the local data, and they were looking at aggregations for weekly. If you look at this, you can clearly see that the average temperature, the average temperature of both local data and the global data were quite close. These are these two lines up. But as you go down and you look at the maximum temperatures, you can see there's a bit of variations. But even then, you're still able to see very similar patterns. And then lastly, if you look at the mean and the max, you can see that there was a bit of a wider gap. And later they realized that the problem was with, for local data, they able to do readings from during the day, basically, between 7 a.m. and 7 p.m. But with the global data, this process is continuous. You're able to get this all the time. So when you compare the two, you will see that gap, but largely you'll see the patterns are similar. So this was just to explain the areas that could be missed out, the coastal areas, and this was for Mozambique. It was able to show some of the areas that were missed out. So as we end, I think the most important thing is that we've indicated that this app is still going through a lot of development. And so it's very important that you try out and give us feedback. So try to make sure you set it up within your DHIS2 instance, and then be able to see if you can do what I've just done in terms of exploring the data. And then also see if you're able to see most of the variables that we've been able to, that is so far provided. But also try and take the next step of importing this data into your DHIS2 instance, and then also do the analysis that we've been able to do. But also we still want to get a lot of feedback from you on how the app is working for you, but also things that we could improve to make this application much better. And so you can use this contact to be able to get in touch. But also you could get more information within that on this link that's provided. So what is next? As you can see, this application is working, but there's still some things that we keep making improvements on. So these updates will continue. There's also a very strong need to have local data integrated. And that one, we're already talking to countries that have local data really available to be able to integrate that. But also most critically, we need to think of the second product, and that is modeling and prediction. It's a modeling tool that can also further enhance analysis. Of course, with this already, we are starting the process of capacity building, including this webinar. And also for us, the HISP groups who are in country, we are on standby to support countries that are interested to implement this application. So with that, I'll stop there and we wait for questions later as I turn it over to Andrew to take us through the next few slides. Over to you, Andrew. Thank you.
Yeah. Thank you, Patrick, and thank you for the good presentation. So mine is a use case from Rwanda. Actually, we've been working with University of Oslo and Patrick, and then HISP Rwanda to see how we can set up this climate app in our health management information system, because there was a push and high demand of having data triangulation between health and climate data. So what we have done, actually, the app is really not complicated. It's user-friendly and easy to set up. So what we did actually on having this app installed in our health management information system, which is a centralized system, is first of all, we configured the Google Earth Engine key in our instance server. Then after that one, we configured or created a few data elements, like 5, which is temperature, relative humidity, precipitation, and others. And also we created the data sets to ensure that these data elements are assigned to the data sets. So what we did was that as soon as we created these data sets, we realized that for us to be able to create, to do analysis, we realized that our Ministry of Health system does not have the country polygons, so we had also to upload the country polygons. So after having the app, what you do is just importing the data. It's automated. You just pick the data element, then you just pull and you pick the frequency. Then you just import the data from the global registry. So this one was really straightforward. We managed to pull daily data for 3 years. Then from there, at least we can be able to analyze and have the dashboard that shows the climate global data and the clinical data. So the beauty of this app is that as soon as you pull the data, it really, you take advantage of existing analytics, DHIS2 analytics, which is data visualizer, pivot table, and others. They all use those existing analytics in DHIS2. So currently what we did, as Patrick said, we said, okay, since we have this data, let us create a few dashboards, analytics, just to allow program people to use them, just to visualize these data sets that are triangulated between climate and health. Then what we have seen, there is a correlation, or there's a relationship between the two. But again, as Patrick said, there's more research needed to really come up with some significant relationship. That's why we are pushing for these modeling and also predictions. Next, Patrick. So next one, actually, it's not a one. It's not one installation, because currently we are also working on the local data imports. We've been working with our Rwanda Meteorological Agency to ensure that also the local data is imported in our HMI system. So we have reached a stage of where they have agreed to give the data for almost 30 years ago, from I think not even 30 years, it's from 1981. Those are the data that they have. So you can understand that these are very good data for predictions. So as a way forward, given that this app is new, we are continuing working with the University of Oslo teams that are developing the app, giving them feedback to ensure that the app is much more improved. We are also working with the University of Oslo to see how we can explore the modeling and prediction tools to ensure that we have like early warning systems. We are also trying to continuously uploading this data from the global data storage to ensure that at least we have more long or multiple years data into our system. So again, we are working with the meteorological agency to do the data integrations to ensure that at least we will be having smooth integration where the data will be moving from their site to our site. So for the data sources, as I said, of course, local data is very critical on what we are doing. But again, also we are combining it with action research to ensure that at least we are contributing to all sides of the project. So for the local integrations, as I said, I will not repeat it. We have really worked with the Meteor Rwanda, and now currently we have already started the integration process and pulling data across the two systems. So probably in the near future, we'll be able to present the 3 data sources together into our health management information system. So this is the end of my slides. I think much have been said by Patrick. Thank you. Back to Ellen.
Wonderful. Thank you, Patrick, for that wonderful demo, and Andrew for talking about the Rwanda Ministry of Health use case. It was really wonderful. And to everybody in the chat, it's been wonderful to see your questions. Thank you, Bjorn, for responding to the vast many of them. We just have a few minutes before ending the webinar. So one of the questions, so we have some time for Q&A, and I welcome you guys to keep dropping those questions in the chat. We'll use this last few minutes to respond to them and also continue the discussion on the community of practice. And another thing that we're also very interested in is understanding what implementations you're interested in running as well. I saw a question from Robbie asking if there are any plans to integrate climate and health data for other diseases apart from malaria and cholera. And really in response to your question, Robbie, that is something that would be determined by your health program. The examples we have right now are with malaria and cholera because that was driven by the interest of the ministries of health and national stakeholders. And then also, I'd just like to remind everybody that registration for the DHIS2 annual conference is open, and we have a slide up here with the QR code where there'll be some wonderful presentations on climate and health work and chances for lots of discussion and interaction. So we hope to see you there as well. Okay, jumping over, there's a question from Melinda about what are the next steps regarding the modeling component, and is there an estimated timeline for that? This is something that we are prioritizing working on. We're hoping I don't have a timeline to share with you, but we are hoping to be able to share updates within these coming next quarters about the modeling component. So please stay tuned for that. And I will also, once again, plugging for the annual conference, we'll be diving deeper into that modeling piece there as well. Maweyata, I'm sorry for mispronouncing your name. Is there any plan to automate the importation processes like weekly or monthly? I'll hand that over to Patrick or Bjorn to answer.
Bjorn can answer, but yeah, I think for now we are really looking at something that can quickly help us get started. But that is something that has been already pointed out. So at some point, I guess that should be considered. But for now, we're able to do it manually. But I can assure you that for smaller countries with fewer organization units, it shouldn't be very tedious. But if you have a bigger country with so many organization units, that can be a bit slow. But yeah, that is being considered.
Thank you, Patrick. There's another question here from Cheryl that is, in case it is possible to correlate health and climate data, to what extent is it possible to embed dashboards into web pages? So I think the question is, to what extent is it possible to embed the dashboards into web pages?
I don't have the full overview of the current possibilities. I think they are a bit limited with the current analytics app. So I think the best option now is to show this on a dashboard. But we are working on solutions for getting this that you can export these elements at least as images that you can then embed on other pages.
Mm-hmm. Thanks, Bjorn. And Sharp, I also want to say that in terms of what we're doing, we're able to bring in the climate and health data within DHIS2. But in terms of looking at correlations, it's still very important to be working with your statisticians and with your technical advisors in terms of really analyzing the data to identify correlations. DHIS2 is not able to identify those correlations, but we're able to bring the data together to help with your analysis. Okay, well, I think that we have addressed all the questions in the chat, and thank you, Alice, for putting the link in the chat to continue the discussion on the community of practice. We really thank you for your time today. And once again, this recording will be shared broadly, as well as we will also have this same presentation available on April 25th in Spanish, and on April 30th, it will be done in French as well. So thank you, everybody, and hope you have a wonderful day.